I was just punching the air with excitement because we got Dr. Shelley Dev in the house, fellow intensivist, which we do not have very often on the show. So there's some straight up props going to you already. But
Wow.
I don't say this lightly. Dr. Dev left such an impression on me. I feel like it was about 6-7 years ago that I so wanted to have her on the show, especially when we talk about physician wellness and burnout. You had to make an appearance on the podcast. So first of all, thank you so much for joining us.
Oh, thank you for having me. What an intro. I wish my kids heard that. They think I'm a big loser. That's so nice.
Oh man, I hear where you're coming from. But listen, the beautiful thing is this is evergreen. They'll be able to hear this forevermore. Young Dr. Shelley Dev. But
well, bless you, young. I'll take it.
Yeah, we'll take it. We were talking about the 2006. That was the last year. That was when you started.
And that's when I started. Yes, yeah. When I started working. Yeah, when I finished training.
It was also coincided with the last year I was happy, but that's okay. So
the Dear Diary moment on the quadcast. Write it down.
Oh my goodness, it's all about wellness, folks. Listen, I want to take us back to when you had your burnout, like your struggle with our lives in the intensive care unit. And I alluded to this before in the intro, but your story, in all seriousness, was so moving. And I remember we were in a lecture, a conference center with I don't know how many old white dudes, and we were all moved. I was like, we were all verklempt after your moving story. So why don't you take us back, Shelley, in terms of your story?
It's a story in retrospect because my understanding of what had actually happened to me came in a very nonlinear way. And I will say that my starting to understand any of this was on the heels of a really difficult time in my life where I had just started working after my training and I had my two sons very close together. And my dad then was diagnosed with metastatic cholangiocarcinoma, so like end-stage cancer essentially out of nowhere. And I think it's like I've described this juxtaposition of a lot of intense excitement and joy with birth and then the absolute terror of death. And I think just the opposing emotions, equally intense, that arose at that time really destroyed me. And more than anything, what was really overwhelming to me was I was afraid to go back to work in a clinical workplace that had so much death and dying. And I was really shook, essentially, by how unprepared I was to face the visceral, deep pain that comes after someone you love dies. I just found it so utterly confusing and disarming how unprepared I was for how difficult that experience was. And I guess I thought because of what we do, I had some sort of inside insight and wisdom about how to navigate this gracefully, and I just didn't. So it because of my fear of going back to work, a mentor of mine suggested or actually connected me with a psychiatrist for grief counseling. And I thought I went under that pretense that, okay, I need to address my grief with the loss of my dad and the myriad responsibilities I had at home with my children. And that's what I thought was going to happen. And I was intending to go for about 6 months. And that's kind of the average purported time it takes to process. And I actually stayed in therapy and went weekly for 3 years. And it's because a lot of my life was revealed to me in a way that I hadn't appreciated. And in essence, of how broken I had become through the process of medical training. And what that left me with, which was a person who had completely and utterly lost sight of who she is and who she wanted to be and what she values and what her personal vision of success actually is, as opposed to what we're told it should be. So yeah, it was an extremely surprising experience for me. And I think I would have described myself or thought of myself as somebody who kind of had her shit together, or, was achieving what she wanted to achieve, which is, on its face is true, but was utterly kind of fractured internally in ways that I did not understand. And I think when you've been that way, or you find yourself in that state, you're so fractured, you don't know where these pieces connect, or you're just sitting with the wreckage of it, and you're going every single day doing your job and in a state of being wrecked and not understanding, why am I so angry all the time, or why am I unhappy, or why am I not feeling fulfilled in my workplace? It's confusing unless you have the gift and privilege of having this space, as I had in therapy, to regard it and inspect it and interrogate it. Yeah, so it wasn't on purpose. I'm not an enlightened individual who thought I must reflect on my state of mind. It wasn't like that at all.
Yeah, you make your story, I think, resonates with a lot of docs for a few reasons. One, I do think too many of us lose ourselves, like lose why we got into this, what our vision of success is, our ties to our values, what's important, because we spend a lot of time trying to adapt and please those around us. So we get into that residency, fellowship, get that staff job. And I really think, as you're saying that, it just totally resonated with me, that there's got to be so many future docs that are experiencing something similar. And then getting back to your original call for help, the loss, like experiencing the loss of your father too. I've lost now both parents, but recently my mother, and it is so true that, like, when you're in the workspace, how I don't know how hard it all is.
Like just being physically proximal and surrounded by it really doesn't mean that you actually truly get it, in terms of like the physical pain of the loss and just the despair that comes with it. And we're talking as people who, see it coming or anticipate it usually, and and still it's indescribable. And I think perhaps that's what it ought to be stated as, is this is indescribable. There's no way to ready yourself and steady yourself for it. And in that way, if it's indescribable and just cannot be put into words accurately, to permit yourself to just feel the heaviness and the awfulness of it. I just simply was not expecting that. And truly, like, when it came, and I don't know if it was the same for you, I was hit with all of these kind of disorganized memories of patients who had died, who, I thought I had done a quote unquote good job being compassionate and kind. And I questioned it completely. I questioned, the veracity of that memory, right? And just felt, I'd like, what have I been doing all this time? I don't understand what have I been doing? What have I been saying to people who've been going through this? Has it actually been of any service to them? was it actually kind enough? You know? So I think it's moments in our job where you must reckon with the fact that there really is no difference between you and your patients.
I could not agree more. And I must say, in the moment, you do feel like cognitively, you feel like there should be a difference, but you're a human being, and I don't know about you, but often we think we're superhuman too. This is where I think we get ourselves into trouble. I remember when I worked the day I found out my old man passed, and then
oh man,
yeah, it was. I mean, it was unexpected, and you often feel like many of us, we don't feel like we have the back then, anyways. I would have handled it differently now, but don't feel like an ability to ask for help, and I I think that superhuman quality, because we, a lot of us, how many people out there work the hours we work, we often have that unfortunate view of many of us, or we even impose it on other physicians, that we feel like we're superhuman, but we're all the same. When we look back at it, you need time to grieve. You need time to digest the heaviness of it all, and yeah, I I'm surprised at how often we view ourselves that way.
well, I mean, it's part of it's the PR of the whole thing, right? Like it's how it's your specialness or your separateness from everybody else is established the moment you get into medical school. And I think that um it's really interesting to me, and I'll use the word interesting as a euphemism, I guess, because what it really is it's fucking maddening to me. how the what we demonstrate is that when people get into medical school and they, like, you're never pushing harder than when you're applying to medical school. Like you're never putting yourself out there more than when you're applying to medical school, especially in Canada. And you're doing all sorts of things to demonstrate your worthiness to enter. And then you do all those things and you create this person who's quite extraordinary through all your experiences and your insights and such. And then you arrive, and the message is that that person is now dead. And now you are becoming this doctor thing. And everything you must do now is in service of this new identity. And it's very fascinating because I've been teaching medical students since I finished training, and it is fascinating. This tacit kind of message is given or is spread so effectively and so quickly that you can meet them in their first week of med school, they're within the first year, and the message has been received. Is like, I need to contort this heavily accomplished body into this framework that everybody is supposed to fit into and behave and speak and emote in the exact same way. And it's garbage. It's like the ultimate con. It serves to erase all that distinguishes any individual practitioner from the other, which is, their life history, all the things that they bring to the table from the outside, right? But this cultivation of this one superhuman, cyborg that can do these things and never struggle and never suffer, the messaging around that is very, very strong in the, like, right out the gate.
I could not agree more, and it upsets me for a few reasons. Not only the mental health of our kids and our future trainees and so forth, but I think that stifling also stifles progress in terms of innovation, in terms of creative solutions, in terms of overall advancement within within healthcare. I think if you are one of the quote unquote outsiders, or you don't fit the proverbial box, you are not welcome. And
No, no,
it's crazy.
and you're right. And you and I both personally know what that feels like, because spoiler for those who aren't physically looking at us, we's colored people and this call. And and I think that, it's particularly painful, a contorting experience when you physically are so obviously not white or male, or have a palatable name that rolls off the tongue or whatever, right? It's like your separateness is so keenly felt and expressed. And, again, the message is received that as closely as you can adhere to what the quote unquote, norm is, and by norm I mean just the people who are in charge dictate what the norm is. It's by no means what the norm actually is in the world. You feel so conspicuous, and we, a lot of us have come through the system at a time where the kids these days call this whole thing gaslighting, where you talk yourself out of this reality that you're experiencing. In my time, like, there wasn't this word that was used. There was nothing you could use, you could say succinctly to describe the experience of it. So it made more sense to say that, well, this isn't really happening, like I'm being sensitive or I'm making this up. Or if I work
it
harder.
felt like it was something on you. Like,
No,
it felt
100%, right?
Yeah.
And other people would furnish those thoughts, like, well, maybe you're reading too much into this, right? And so, a several years of that kind of internalized thinking, right? That it's no wonder that at some point in our lives, like, when you reach that point in your life where you're building your life now, and you as a human being, things are happening that are unexpected and painful and difficult. It's no wonder that we fall apart. We're so ill-equipped to be honest about not just our origins and the real, and to live honestly as like, this is who I am, this is where I come from. We haven't lived honestly as humans who, yes, will suffer, and yes, will lose things, and yes, will be disappointed and heartbroken and devastated, right? It's no wonder that we're rattled when our own humanity looks us in the face,
Yeah, it's uphill, man. It really is uphill.
Well, it's an undoing, right? Like, it's an unlearning of this is the right way to be. And until all of us like snap out of it and say, well, who said it's the right way to be? Right?
Yeah, absolutely. And I mean, I'm curious to hear how you snapped out of it, because I feel like many of us have fortunately snapped out of it, and I think the journeys to that will look different for many of us. But how did you get to where you are now?
It, like, like the original story, it wasn't on purpose. Like, I am not that clever a person. Like, I am the beneficiary of a lot of luck and timing and being asked the right questions at the right time. So for me, it was, I was like 10 years into working, and a graduate of several years of therapy by then, and had, personally kind of grown in many ways through tragedies. And I was asked to give a talk or a speech at a retreat about my thoughts on well-being, on my own wellness or what have you. And I had just never been asked this question before. And this is when the whole wellness, revolution was, in the earlier stages of it in medicine, I should say. And I just had never been asked that question. And I was kind of, amused at people asking me this. And I thought, and it was for residents who were training in internal medicine. And it was a retreat where there were going to be a mix of people, some trainees, some, staff physicians. And I was very honored to be asked to make a speech at this particular retreat. And it's supposed to be kind of like a speech that you give to reflect on your career. But the ask was through the lens of well-being as well. So when I started to write it, I realized that there's no way I could write about being, mentally healthy without talking about when I was mentally unhealthy. And, in the throes of me being in therapy, I, was mercifully told that I had anxiety or generalized anxiety. And it was merciful to me because it was an explanation to me for why does my head go in circles so much and is full of so many things that I can't seem to quiet down. So I had come to understand myself as somebody who mentally wasn't well. And now with medication and with therapeutic intervention, I could say I was, but I thought it was disingenuous to not talk about the before and the current time, which was more of an after. So I, spoke to my husband, who's like my advisor. And I said, I can't do this without saying this stuff honestly. And he said, well, then just say it. Like, you're not afraid to, you're open to talking about this stuff. And I had been on a one-on-one kind of basis, but certainly not in giving like a big speech about it. But I still thought, okay, this is fine. I didn't really think about it too much. It just felt right. I am allergic to, not being truthful. So I said, this fits. This sounds like something I would say anyway. So I gave my talk and I gave this speech. And honestly, it was a moment for me where my life was irrevocably changed, because the response in the room to me talking about my mental illness and being in therapy and what I've learned from it and what I've taken from it and what I think we must all take from it, or that lessons that could be helpful for other people. I was really, really not expecting the response that was from that crowd that was so emotional and big. And after then, there was an interest in having my speech kind of circulated, in the form of like an essay or a written piece through the University of Toronto's med school. And again, I asked my trusted advisor, my husband, should I let them post this speech? And he says, well, nobody looks at emails from the med school anyway. So we delete those emails. So let them post it. And I go, yeah, that sounds right. So only with the ardent belief that no one would really look at it anyway, and just to be like, polite, I said, sure, you can post this speech. And that was it. Like, that really completely redirected the course of my career, my academic career, which was to become this person who people felt they could relate to in terms of having gone through hard times and having to work really hard to get back from it and recover from it. So it was, it was not intentional at all. It was by no design of my own. Like I was asked a question at a time that I was ready to answer very truthfully. And probably like at a stage in my career where I felt like the consequences to me, whether they be of stigma or professional fallout or anything, really wasn't there. It wasn't like I'm somebody in residency or fellowship looking for a job and talking about my mental health journey, right? Like the stakes as I see them, because people have been very kind to me to say that I've been so, using very nice terms to describe me coming forward to say certain things. I reject all of it, because it's like, I think the stakes were low for me to say this. I was secure in my job. I was secure in my reputation professionally, and choosing to say something revealing to reveal something that other people could cast as a weakness or something. I didn't feel the risk. I genuinely didn't. And it was timing. it was timing, and I had a lot of time to think about it.
Mm-hmm. But there's something more, Shelley. Like, yes, it was, there was timing. Yes, this quote unquote stars aligned to be able to bring this up. But it's something about, it's your authenticity, I think, that really made your, like, seeing you how authentic you are, which is unique in medicine, is what's making you shine, in my opinion. Like,
nice.
it's,
well, you know what? That's very, very kind, and it's also very meaningful to me that you say that, because my worry is always going to be, when I'm talking about these things or offering an insight into it, that purely is stuff that I have personally found helpful. So I hope that other people might find it helpful. It's not saying this is how it should be done. It's that here's what my experience has been. The reason your words mean a lot to me is because I really feel as though I spent a huge amount of my training in my career behaving in ways that were so contrary to what felt right to me. And I worked so hard to behave in those ways because it appeared as though that was how, good doctors, smart residents, capable physicians behave. They behave as though nothing bothers them. And I struggled so much to make it look like nothing bothered me. And internally just kind of berated myself and belittled myself for the fact that it did bother me. And the only reason that I could come up with that I was feeling differently than what it seemed other people were feeling was that I am just not good at this. I am just not as smart or not as capable or not up to the task. And that was the only thing I could come up with, is like, Shelley, you do not belong here, in the sense, not in a way that was like empowering to me as someone being different or unique. It was, you are not up to this task. You're not as good. And it's so rather joyful for me, in a way, to be honest, to be honest about how it actually is and how difficult it can be and how difficult it has been for me, and how difficult I find the job, to be honest. It's joyful for me to be able to say that and have that be helpful to hear. Like, I still can't get over that. Like, it's mind-blowing to me, to be honest, that to say it is comforting. Like, because I'd spent so long, I'd spent 20 years fighting against saying that, or concealing that, or not even saying it out loud to myself.
I mean, that's how powerful of a force you're up against. I mean, I could speak at a personal level too. It's doing the admin side as like, I feel personally at my day-to-day job, I could show my true colors more than I ever have before, but I struggle with it from an administrative side. When you're amongst the leaders, you're amongst the people that you take direction from. It's I find that area still to this day hard to show up as your most authentic self. But I think what I often try to remind myself is you're actually here because you're because of who you are, not because of a persona, not because of who you think you should be. It's because of you. It's because you showed up as a cordial care man thing. You showed up as Shelley Dev. That's why you are in the spot you're in, and I think it's personally I find that comforting at times where you're hesitating to speak up or hesitant to like I said, show your true colors.
Well, I think I think what lots of people who are in positions of authority or have been for a very long time, I often, look at people who don't understand necessarily how difficult it is to keep parts of yourself under wraps, like consciously, and realize that in doing so, you're being given opportunities by like strapping yourself down, um, and I think that I sometimes look at folks who don't have to do that, and you know who they are, and you think, what is it like to believe that every thought you have is worth saying out loud? Like, what the fuck does that feel like? Like,
It's
how
so
many
obvious too.
fewer wrinkles do you have because of this, right? It's bonkers.
Oh man, it's so true. I love. I mean, I don't know if they know. I don't
I
know.
don't, and the thing is, I don't think that they know. And again, that's not an excuse for not knowing. Do you know what I mean? Like, it's
Yeah.
like, well, I don't know. It's like, well, I don't, I don't fucking know a lot of things either. So I get a book and I read about it, or I become
Google it.
inquisitive, right?
Yeah.
But it's gobsmacking to me where you just kind of sit there and go, wow, you just had that thought and said it.
Mm-hmm. And
Because you can. And I think that is what, as you get older too, I think you get less and less, you're less and less willing to be so restrained, because you feel like saying, come on now, I'm a grown ass person, right?
yeah.
Come on, I've been doing this for a really long time. Come on, like let's be open. And again, we're not arguing for being gross and belligerent. We're arguing for, you know, making salient points about where we see inequity, or where we see disadvantage, or where we need to hear more from different types of people.
Absolutely, absolutely, and yeah, and I think obviously with the like post George Floyd, you're hearing more movement for diversity and inclusion, that we're moving in the right direction in so many ways, like that people that normally wouldn't have a voice are being heard, but obviously I think there's a lot of work still to be had.
Yeah, I still feel as though, culture outside of the hospital progresses at a certain pace, and inside it is a totally different glacial pace. Like, at the time of George Floyd, I don't know, like I found there to be way too little discourse in my surroundings, for sure. Like way too little. And only when I would speak to people one on one, you would see the pain this was bringing up for people. And the frustration, and and of course, like the collision of that with the pandemic, and so many frustrations with that. It was just, there was a lot of pain, and in these specific conversations I was having with specific friends, a lot of them who were nurses, um where there wasn't like an open communal conversation, you know and it's like, the fact is, we all step outside the hospital into our real lives every day. And the contrast of your real life outside the hospital, and you're waiting in the culture at large outside, but then when you go inside, you're pretending in a certain way. And that's a very burdensome thing. That's a very, very burdensome thing. And I would see that, and that's hard to see. That's hard to grapple with.
Absolutely. It's like that dissonance. It's
Yes.
yeah.
Yes. Yes.
Yeah. And I mean, I'm just reflecting back at that timeline, how crazy it was. I mean, one of the memories that I unfortunately tie that to that whole George Floyd timeline was the tokenism. Like that was one of the things that irked me the most. Was yeah, we'll have some DEI program, or we'll appoint some person of color or BIPOC member into some committee, but completely ignore them, or put out, or even worse was when they would just put out their statement but no action, like no real action, no teeth in the game.
100%. I mean, those things I've talked to lots of people about. Like, I get asked questions about, what would you say to groups, hospital groups, or leadership about these kinds of things? And I would say, I know what you're doing. You're setting people up to fail.
Word.
And you're making one spot for one person to cure racism and sexism, without so much as like a fucking office with a window or something, right? Like how, and the box is checked. The same thing has happened with well-being, right? And burnout, and the box was created for it to be checked. And in that box is one little person who sits alone with no army around them of supporters to get things done. And by get things done, all I mean is to, create a culture whereby these things are openly talked about amongst people and brought into the conversations in the workplace. But yeah, like it galls me to see these things happening and people believing that I can't see what this means. Like, this is designed to fail. This is designed to fail. To really change a culture, or to really move a culture, first of all, cultural change is generational. It takes a very long time of concerted effort. And it's like cognitive behavior therapy. It's like changing beliefs and behaviors, right? And a module is not going to do it, right? A flyer or an ice cream truck with treats is not going to do it, right? It's like this commitment for generational culture change is that we are looking at the ways in which we can evolve our behavior so that we can serve our patients better through serving each other better. That's always been my little dream, that one hospital will change their mission statement, radically change it from, every hospital's mission statement is, we provide the best care for our patients, or patient care is first. Like, I would love it if some really forward-thinking hospital goes, we know that good data tells us that when our healthcare workers feel mentally healthy and communally supported, they will care for patients better. So our mandate is for happy, healthy healthcare workers so that our patients can have the best outcomes.
Thrive. Absolutely.
Right? That's to me the way to do it, but
that'd be gangster.
Right?
It'd be like
905. So yeah,
905. I like it though. So whether you're talking to your younger version of yourself, or you're talking to that young nurse doctor that's struggling post pandemic, what are the key things that you highlight? Like, I mean, we've talked a bit about the authenticity piece, the openness to be able to speak about the struggles and not being superhuman. Are there any other things that come to mind when you think about those that are in the throes of it?
Yeah, I think Something that's helped me quite a bit personally in the last year was I really started to kind of deep dive into what it means to be mindful and meditation and things like this. And I have been a big failure at any of this stuff. Like I found it really difficult to understand what it meant. And my therapist for many years had said to me, I really think you should consider doing mindfulness-based stress reduction. It's like a course. And he said, I think it would help your anxiety quite a bit and help you kind of regulate yourself at intense moments. And I kind of, I put it off for a while. And then last year I enrolled in this course, this online course. It was like an 8-week course where you, once a week, you meet with these people online who you don't know, like strangers that are led by an instructor. And it's like 3 hours for one night a week. Okay. And I was like, I'm going to try this. I'm going to see what this is all about. And I have to say, at around week 6 of 8, I start to see what this is for myself. And I start to see that, okay. And I had to, put aside my preconceived ideas of what it meant to meditate or what it meant to be mindful. And understood it as a period where, a short period even, where you are noticing your thoughts and identifying them as thoughts. So it's not clearing your head of thinking entirely. It's dedicating like a moment where you, perhaps at a time where you're feeling really strung out or really stressed, and you pause and you kind of notice all of the thoughts in your head as they're arising and say, oh, that's a thought. Oh, there's another thought, or there's another thought. And the next step is to then be curious about them and ask yourself, I wonder where that's coming from. Like, where did that thought, like, why am I worried about this? And I was so struck by this because I found this to be, very doable in a very short period of time. Like if you look at, mindfulness exercises for small kids, there's this really cute one that has the acronym STOP. And I've told trainees that I speak with when I teach about this stuff, where it's a particularly heightened moment, or you're just feeling disorganized and whatever, and you stop. So it's meant to be for 1 minute. So you could set your phone timer. So S is the stop of stop. T is you take a breath in through your nose and out through your mouth. And O is you observe the thoughts as they're coming in your head and just notice them, right? And kind of wonder about them and like, okay, I'm thinking this, I'm worried about this, I'm, remembering this. And then the P is the end. It's the proceed. It's like, okay, what are you going to do with all of this now? You like hop back into your real life. And I gotta tell you, like, I have found myself in moments like in the ICU, like in the heat of it all. And there's so much chaos and noise, and I have a billion things I need to do. And I just kind of, in my head, just like, I take a breath in and out, and I just hold on a second. I'm like, okay, there's a lot going on here. And just kind of collect it, right? And it's almost like you're observing yourself in the situation. And first of all, it's very achievable. Like it's a minute, right? It's not like you're going to a quiet room and in the dark and sitting on a mat. It's like a minute in the midst of something. And the reason I think, so it's achievable, but the reason I think it's so important is that it's a way of checking in on yourself and asking yourself, like, how am I doing right now? And it's a purposeful asking of yourself instead of just carrying on. And I think in medicine, this archaic calcified notion of what resilience actually is to just carry on. And, the last person standing who needed the least amount of sleep and the least amount of food and bathroom breaks ends up being the most powerful of us all, right? Like that's what resilience is in medicine. But the truth is, what it really is it's about assessing yourself. It's about really looking at what you're going through, what you've gone through, how you've had to adjust yourself, and how you've changed because of what you've gone through. Like that's an actual psychological construct of resilience. It's said to be like adapting to, recovering from, and growing following something adverse. So it's very purposeful, right? It's like really thinking like, okay, what happened there? Like, for example, in COVID, or after George Floyd was murdered, or the loss of a loved one, what happened there? And what did I have to do to get through that? And how did that change me? And actually considering like how you've been affected by things that you've gone through. And the only way you could possibly do that, I would think, is to ask yourself, how am I? Like, and to tap out for a second and say like, okay, how am I with everything? Like, you know, and that's something I constantly talk about with people when they're in it. Because when you're in it, you can't see. It's the analogy that I got from my mindfulness course was this idea of the stream of consciousness, where it's a stream, like a literal like water stream of thoughts and feelings, emotions, reactions. And when you're in the stream, you can't see what's around you. And so the argument is, what if you stepped out of the stream onto the bank and watched the stream go by and watched all the things in your head?
I mean, I love it. I love it for so many things, because in this 2024 culture we're in, where we're constantly moving, constantly stimulated, we don't take time to reflect. And the magic is in reflection, yo. Like it really is.
Work. It's like, what did that all mean? Right? Like the meaning. It's meaning. Like you're looking for meaning. You know, and if you're just going through in the street, like if you're just getting shit done, right? That is medicine's, trick of making us fixated on outcomes. It's process. It's the experience. It's the in-between, like it's the in-between of like pass and fail and live and die. And do you want everything or do you want nothing? Like these bogus, poles that we've constructed every single thing to be in one side or the other. Everything's in between. It's process, right? And so, like if you're, and do not get me started on like the 2024, being consumed by phones and shit, because I'm telling you, I don't think anything good has come of this. Like, I just don't. I think it's just robbed us of so much important connection.
Oh my God. Walk through Dulles or any airport these days, and couples will be walking side by side and the phone's right in front of them. They'll be at dinner together.
What for?
You know what I mean? And it's...
What for? Like, why are you out?
Exactly. I mean, the other thing is I find people don't even want to be out now. They'll just be like, oh, I'm good to be hunkered down in front of my IG account or my TikTok, looking at all this shit. Like but just to reinforce though, I do encourage everyone to have some kind of reflective practice. Like honestly, that's where the gems are, man. That's where and not to digress too much, I think this is part of what we missed in COVID. If you're looking at a systemic way of addressing burnout and people's wellness, like it would have been so beautiful for us to collectively have that reflection. What went well? What went bad? What can we learn from this? As opposed to, let's stay busy and truck on to the next problem. Because I really truly believe that it's healing to go through that kind of process.
Well, you can't recover or you can't heal without it. And when we all say things like reflective practice and mindfulness, they evoke time commitments in people, which is why I think people are turned off by it, right? Firstly, that I don't think it's really well understood what we mean by it, and for me personally, I didn't really understand until I really learned about it, right? And then to once you understand it, realize, no, this is something that you do have time for, and by time I mean a few minutes, right? They're really smart people who study time and time psychology. This idea that we are time poor is all it's a perception. It's a perception that we have because we're fucking giving away our time to shit that does not matter and does not make us happy. Like the thing that makes us happy, I believe, and I know I'm not the, a lot smarter people than me believe this, is being with people that we really, really love and like. It's absolutely true.
I could not agree more. And this is another thing that I think was highlighted during the pandemic, is spending the time away from those that we love and care for. There's a void, and I'm hoping people are seeing this and spending more time with the ones that they love and care about for that reason. But
yeah, well, one way, like my way to talk about this is I call it going first. So what you do is every person checked in on a buddy just like that, like out of the blue, and was like, hey, what are you up to? If everybody did that, I think we would all be on the receiving end of the, hey, what's going on? Right? To be thought of, and to like yank somebody out and just be like, I'm coming over with coffee, or like, meet me here. I see it in my kids, like they're teenagers, and as much as they claim to be fulfilled by connecting with people online through whatever games or whatever, when a buddy shows up to the house, shit, the squeals come out. And these are teenage boys who have no business having these high-pitched squeals anymore, but the squeals come out, and you can't replicate that. And so my younger one, he would say to me, we were talking about being online with games or whatever, and he's like, come on, it's my joy. And I go, no, babe, I really don't think that's your joy. He goes, what do you mean? And a friend of his was over at the time, and I go, your joy is your friend being here right now. Like, you two together, whatever it is you're doing, you could be online together, whatever. But the fact that you're here together, that's what's bringing you joy right now. And he kind of looked at me, and the kids, they'll look to me and they were just like, no, that's fair. And I go, it's different. That is joy. That is joy.
Mom dropping truth bombs all over the place. The boys know what time it is, for real.
Oh my God, I can hear them rolling their eyes right now from the school building. They're just like, why is this bitch
calling? Oh my God.
Anyway.
Listen, Shelly, this has been fire, as the kids would say.
Oh.
This is I mean, I learned a ton. I feel like I'm meeting and talking to someone that's cut from the same cloth, and your reflections really had a soft place in my heart too, just especially hearing about your experience with your dad and getting through all these challenging times. And I just really want to thank you for your authenticity, your courage. You're something else. You're special. And we're very privileged to have you on the show. So I really appreciate you taking the time.
The feeling is entirely mutual, my friend. Thanks for the kind invitation.
Absolutely.